Hello and welcome to the program. I'm your host, Neil Howard. Thank you so much for joining us here on Health Professional Radio. Going to have a conversation with Donna Cryer, CEO of the Global Liver Institute, and Wayne Eskridge, founder and CEO of the Fatty Liver Foundation. They're joining us here on the program to talk about non-alcoholic fatty liver disease. Welcome to the program, both Donna and Wayne. Thank you for joining us.
Thank you.
Thank you, Neil.
Well, Donna, what is it that causes fatty liver, and what exactly is NASH?
Fatty liver disease is increasing right along with rates of obesity and diabetes, and it occurs when a certain amount of fat has infiltrated the liver and starts to damage the liver cells and so overcome the liver's natural ability to regenerate that it's then termed a disease. And so NASH is non-alcoholic steatohepatitis, but basically it's a more advanced form of fatty liver disease that has started to cause even more damage to the cells and can lead to needing a liver transplant, and it will be the number one cause of liver transplantation by next year, and can lead to liver cancer and even death. So it's a very serious problem.
Why is it so important to differentiate it, from alcoholic liver disease?
Well, I think when you know the cause, then you know the solution. So everybody assumes, or many people assume, that liver disease is caused by alcohol. And so telling someone who doesn't drink not to drink is not going to help them with their liver disease. So, as you know, liver disease can be caused by genetics, in this case by lifestyle, the environment, viruses, and that's why you see children with fatty liver disease and NASH, people of working age, and seniors. So it really can affect everybody, but it's most common in people who are overweight or obese, or have type 2 diabetes, or high cholesterol, or some type of another aspect of metabolic syndrome, of which this is a part.
So basically, anyone is at risk. Why aren't we hearing a lot more about this condition?
Well, we haven't really focused on liver health, and that's why both Wayne and I created our organizations as liver patients, wanting to make sure that other people, frankly, didn't become liver patients, or if they did, they had the resources available, and that there was more attention by the public and communities, and I'll be on Capitol Hill later today amongst policymakers to make sure that it doesn't go ignored. It's often referred to as a silent epidemic. I think it's a hidden epidemic because it exists. It does actually have symptoms. It is affecting people's lives negatively. And so we're trying to bring it out of hiding today and make sure that people are having conversations with their families and with their doctors about this so that they can take action to promote their liver health.
Wayne, why is it so important that we get the message out now as opposed to 20 years ago? It's even more important now. Why is that?
Well, it's become so common, and the consequence of the disease is just a disaster. When you have end-stage liver disease, it is devastating both to your family. You're going to die probably, but it also is overwhelming our medical system. It's so expensive to treat. So it's far better to reach out earlier and when you can actually stop this with a change of lifestyle and how you approach your life. So it's not necessary to get this if you actually want to take control of it and have a better approach to your food. It's fundamentally, this one is fundamentally based on food, and what we say about it is if you care enough, food is medicine. It really is.
Would you say that the Fatty Liver Foundation is an instrumental part in getting the word out? I mean, what type of support mechanisms do you have in place? Educational awareness mechanisms do you have in place there at the Fatty Liver Foundation?
We set out, when I had my diagnosis, I found that the information that was available in Dr. Google was just very poor, very fragmented, and often contradictory and wrong. So the goal of the foundation website is to provide a science-based understanding of the disease written in layman's terms. So we want to give people consistent, documented information about what happens and what they can do and be kind of a guide. We don't provide recipes, but we provide the information so how people can think about this disease and deal with it as they plan their lives, because it's a problem that isn't a single thing that you do. It's things that you do habitually. It's the everyday life that you lead. And so you need to think about those things in terms of what's a healthier way to live.
A very personal endeavor for you. Donna, as the CEO of the Global Liver Institute and the liver transplant survivor yourself, what do you tell people, and what should they be talking about to their doctors when they suspect problems? Well,
we have the privilege of working with 60 partners on International Nash Day across the world in 22 different countries who are trying to give the same advice to patients all over the world. And I think, I might boil it down to 3 C's, conversation, coffee, and clinical trials. So the conversation with their doctor is about how can I be, tested for fatty liver disease, and what type of support can I get for the type of lifestyle change that Wayne discussed. So most of the successful patients that I've talked with have had some type of dietitian working with them, or behavioral health support for, if they've been trying to lose weight for 20 years, they're not automatically, all of a sudden going to start being successful about it. So what type of supports are available and reimbursed with their insurance company? Many people don't realize that there are those types of supports available to them within their practice, or sometimes within their health plan or the communities. And so we want to make sure people take advantage of that. And then I don't want this to all be about, restriction and doom and gloom. So if people are drinking their morning coffee, they're doing something for their liver health. And then if you're doing that one thing, maybe you can do, one thing more. And then understanding if you are eligible for a clinical trial is also one of the most important things that people can do right now, and the message that we are sending out in the U.S. and around the globe.
Wayne, as a hidden epidemic, what resources are there for people concerned about this, or maybe who are struggling with it themselves?
It's a difficult problem in our society because we haven't invested in the tools that would be really helpful to people. So, one of the things that we hope to highlight in our efforts is the need for better support for people as they try to get a handle on this disease. Right now, it's very much a matter of patient-to-patient forums, people working with each other, local support groups. There are certainly medical teams that are working on it, but that's not the common practice. If you're lucky enough to be in an area where the medical profession has focused, then that's great. But in much of America, liver disease is not approached as something that you deal with long term. What you can't have is to go to a doctor and he says, well, you have a fatty liver, and so lose some weight and come see me in a year. In order to provide people with information, that's part of our goal, is that they have to think about it on a routine basis and develop new ways and habits. And that's the purpose of our FattyLiverFoundation.org is to help provide some of that. And one of the most effective tools that we have is people working peer-to-peer in forums where patients help each other, because we do become very knowledgeable about this as a group.
Now, I heard you mention a website. Could you mention that website again for our listeners? And then, Donna, give us an online resource where we can go and get more information about your organization as well.
Sure. FattyLiverFoundation.org.
Great, thanks.
And we are globalliver.org.
Thank you. Thank you so much, both of you. Donna Cryer, CEO of the Global Liver Institute, and Wayne Eskridge, founder and CEO of the Fatty Liver Foundation. Thank you both for joining us here on Health Professional Radio.
Happy to be here.
You've been listening to Health Professional Radio. I'm your host, Neil Howard. Transcripts and audio of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to this podcast on iTunes, listen in, and download at SoundCloud. And be sure and visit our affiliates page at hpr.fm and healthprofessionalradio.com.au.
Thank you for listening to Health Professional Radio. We're very proud to be an independent broadcaster providing our content free of charge to you, the listener. One of the ways that we're able to remain free and independent is by having people like you become patrons. You can support Health Professional Radio simply by visiting hpr.fm and clicking the button that says Become a Patron. Your patronage of even just $1 a month lets us know that you're there, which in turn makes us more valuable to advertisers. And, of course, if you're able to afford more, then we would certainly appreciate the support. My name is Toby Longhurst from Health Professional Radio. Please visit hpr.fm, click the Become a Patron button, and support us if you can.